Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk about some of the anatomical landmarks of the stellate ganglion that you can find on yourself today. In the distant past, stellate ganglion blocks were placed without any visualization. So I've mentioned this before in other videos, but in the early history of stellate ganglion blocks, they were done for vascular issues of the arm and upper extremity pain syndromes, and for some arrhythmia syndromes of the heart. And when they were originally created, they were placed with no visualization at all. So this is long before ultrasound, this is long before x-ray, and they were just done all by feel. And there is a little bump on the C6 vertebrae called the Chassenax tubercle, and it sticks up from the vertebrae just a little bit, and you can kind of feel it in your own neck. So right here, if you rub, kind of here's your trachea, and then you move a little to the side of your trachea, you can kind of feel this little bump right there. And if you rub it, it feels a little weird. That's Chassenax tubercle. And in the far distant past, about 80 to 100 years ago, doctors would feel for this little tubercle, kind of pull aside the carotid artery, and that's where they would inject their needle. Now, we use that same tubercle on ultrasound because you can kind of see the little lump of the bone, which is the tubercle. Tubercle is just a fancy name for a little protrusion of bone. You can kind of see that, and that's one of the landmarks that we use to know that we're in the right location for the C6 part of the stellate ganglion block. So we still use that landmark today. It's just now we see it under ultrasound, and in the past, they used to just use it by feel. But you can feel it on yourself at home. It's slightly above the area where your neck meets your shoulder, and it's just slightly to the side of where your trachea is. But I hope that's kind of a fun historical fact and something that you can kind of feel on your own.